brings us through to the NDIS. I mean, it's the generational, probably bigger than generational change in not only Victoria but across the country. We've got a number of sites up and running with the balance to come over the next few years. As the Minister, what's that mean to you?
Well, we say it's the biggest government's social policy reform since at least Medicare. I think that's right. I actually think it's the biggest change in disability care ever, certainly on par, if not bigger, in terms of the lives it will touch, in terms of the deinstitutionalisation process from a generation or two ago. But what it means is giving form to those aspirations that we were just talking about. People with disabilities are disproportionately badly overrepresented in every negative measure you can find. Employment, health, lifestyle, housing, and so on goes the list. This is that one opportunity to bring those commitments that so many of us have made to building better lives for vulnerable Victorians and giving it real meaning. And so far, despite many challenges, we look like we're on the path to achieve that in the next 3 years. So to make sure that 105,000 Victorians are in this scheme by 2019, with a whole change of emphasis about how their lives can be better, is the focus. And that means really tipping the existing world of disability specialist services on its head, as both a funding model changes and an approach to how disability services are delivered in the context of wider service delivery.
I reflect on the people we work with in the Barwon area and now in North East Melbourne area who have had now access to the NDIS and compare them in general terms to other people we work with a disability. There's definitely a difference in the way they approach their lives and their engagement with us as a service provider than what they used to. And that's only in the last few years we've seen that happen. So the evidence is on the ground already, I think.
Yeah, and I've picked up anecdotally the same kind of things. It'd be interesting to see what the first real reports of other areas come in. Because it's not just about changing service delivery, it's about changing the mindset of people with disabilities. To change from that passive recipient of cookie cutter, we know what's best for you care, to that assertive support, that advocacy-based system that says this is your right to participate in our society. This is your right for the same kind of opportunities that the rest of society takes for granted, and you need to pursue that. That's why advocacy is such an important part of that rights-based framework.